Hi, my name is Dr. Arbaz and I am from Omar Welfare Association. I serve as a project manager in one of the projects that we're doing here. Today I'm going to talk about the hidden dangers of tobacco smoking on women's reproductive health. So as you know that tobacco smoking or the use of tobacco products are very detrimental to health of women and men both. But a lot of women do not realize that tobacco smoking or the use of tobacco products is one of the most dangerous habits pertaining to their reproductive health. Most women are unaware that tobacco smoking or the use of tobacco products can silently make it difficult for them to conceive. Surprisingly, many women are unaware of how tobacco smoking can affect their reproductive health regardless of their background, from fertility issues to pregnancy complications. Let's take a closer look at how tobacco smoking or the use of tobacco products can seriously affect the reproductive health of a woman. Regular smokers experience a variety of health issues and gynecological problems such as irregular bleeding, painful bleeding, vaginal dryness, mood swings, and most importantly of all, infertility issues. It can also cause, and it is a leading cause of cervical and uterine Women who smoke are at a higher risk of developing these complications. And these effects can make it difficult for them to conceive. Let's talk about what happens when a woman smokes or uses tobacco products during pregnancy. Smoking during pregnancy has extremely severe complications on the mother and for the unborn child as well. If we talk about the mother, it can cause a condition known as stillbirth, where the baby dies after 20 weeks of pregnancy inside the womb of the mother. Also, it causes a condition known as preterm birth, where the baby is delivered before term, that is 37 weeks of pregnancy. Another really painful condition is called placental abruption, and it is when the placenta detaches from the uterus. In some women, smoking can also manifest as higher blood pressure throughout their pregnancy. And higher blood pressure can often, in combination with other problems, can lead to preeclampsia, which is a condition in which you have high blood pressure and proteinuria after 20 weeks of pregnancy. This, again, preeclampsia is a very severe condition and predisposes the women to several other health complications. Spoke earlier, babies born to the mothers who smoked or used tobacco products during pregnancy can develop serious health issues. These include low birth weight and microcephaly. Low birth weight is a condition where the baby's birth weight is lower than a healthy baby, and microcephaly is when the baby's head size is smaller than a normal healthy baby. Both of these conditions predispose the infant to frequent infections, delay in developmental milestones, and at the same time it can cause feeding problems. The babies born to these mothers can also develop lung and cardiovascular problems later in their lives. There is also a very rare disease or condition seen in babies whose mothers smoke during pregnancy. This condition is known as sudden infant death syndrome, abbreviated as SIDS. As the name implies, this is a condition where, and this is usually seen in babies born to mothers who smoked, the babies die suddenly without a known cause. We just talked about how smoking and tobacco use can affect women's reproductive health in various ways, ranging from their menstrual health to infertility problems, to problems and complications during pregnancy, and to even severe health issues in the unborn child. Now let's take some time out to discuss what other forms of tobacco are there. We all know about cigarette smoking, and it's proven to not only be a cause of a lot of cancers, but also, again, as I said, has deleterious effects on the reproductive health, especially in women. But other forms of tobacco that are increasingly being used now are e-cigarettes and vapes. And a lot of people are under the impression is because they don't have the certain carcinogens and they don't have the tar that a cigarette has, that this form is less harmful. But studies have proven again and again that we still don't have that longitudinal data to show how deleterious e-cigarettes are, but also the early results show that these are as harmful as normal cigarettes. At the same time, a lot of people also think that e-cigarettes and cigarette smoking are really harmful, but some people use other forms of tobacco, such as kheni, such as pan, such as gutka, such as moist snuff, and these are some of the common forms of tobacco being used. But the truth is that these forms of tobacco are as harmful, are equally harmful than using a cigarette. If you or someone you know is struggling with smoking, there are resources available to help you quit and take control of your health. Talking to someone about quitting smoking can be the support you might need to see it through. Consider talking to an expert for help.